Tonight, I think that it's awesome that you would take a half hour out of your lives to learn a little bit more about your health. One of the things I want to do is just change your perception tonight of how the body works and how it functions, because we have this idea in our culture that, and we've been taught this, that pretty much everything that we encounter in life in terms of a health issue is a pharmaceutical deficiency. So if you have a problem, the pharmaceutical industry would tell you you were born with a pharmaceutical deficiency, or you developed a pharmaceutical deficiency. So I want to change a little bit of that tonight. So one of the things I want to talk about, like some of you have been to a lot of my talks, I've talked about toxicity, which is a great topic. I've talked about hormones, one of my favorite topics. I've talked about diet and nutrition, okay? Really, really important, okay? I've talked about one coming up is how the food industry purposely damages our brains. It's a talk that everybody should come to, and that's coming up, probably in a couple months. But today, the talk I'm going to talk about today is really the main thing about how our body works and how we stay healthy. So we're gonna have a little show and tell here tonight. I want you to participate with me. So here's what I want you to do. When we know that our heads contain our brain, out of our brain comes our spinal cord. Our spinal cord is really an extension of our brain, all right? And then you have the nerves that come off the spinal cord, really an extension of our spinal cord. So I've taught everybody that you have to have this curve in your neck that looks like this, okay? You have to have that. So the spinal cord follows that curve, okay? Follows a curve in your neck, very important. So I want everybody to do this, to drop their head down like this. Okay. Now, does everybody feel how that's pulling on the back of your neck? Okay. This is not a normal, it's not a good position for your neck to be in for very long. So what we're doing here is we're literally stretching the spinal cord and changing the way that our brain and our body communicate with each other. You can put your chins up now, okay? So when you've got a reversed or a changed curve in your neck, when the curve in your neck is changed, this is what you have all the time, all right? So I want you to think about that as I go through this talk. So we have this thing, and we call it the safety pin cycle. And this is why we call it this, because it's easy to remember. If you look at a safety pin, this is a really good model of how the body works. You have the brain, you have the rest of the body, and you have the nervous system, which communicates with the brain and the body. Now, all primary care doctors that have the intention of the body to be healthy and express life know this, okay? A subluxation, okay, disconnects the body from the brain, okay? So the brain cannot communicate as well with the body. So that's one of the things I want you to take away tonight. It's just like a safety pin, okay? So every time you see a safety pin, at the top is the brain, the body, and the loops of communication between the brain. Now, how does that work? Well, this communication system is not like a chiropractic philosophy. It's not something that we just learn in chiropractic school. Nobody else learns it. This is a law, a scientific fact of physiology. This is how your body works. Your body, things happen in your body. It goes up to your brain, okay? That sends messages to your brain. Your brain then changes how your body's going to respond and sends that back to your body so your body can change. And it does this all day long, every second, day in and day out. So, like, think about this. If let's say you get a pebble. Anybody ever in here ever got a tiny pebble in their shoe? Yeah. What does that change? Change the way you walk? Absolutely it does. It changes the way you walk, changes your gait. You don't just walk the same. So what does that do? That feeds information into your brain. And if you walk like that long enough, the brain then sends signals to your body to change the way you walk, change your gait, to take pressure off your foot. Okay? So it may throw a curve into your spine, or it may change the way your spine is structured, and because it's trying to take pressure off your foot. Well, that's the way the body works for everything. So think about it like this. Anybody in here ever had like a type of food poisoning?
Yeah.
Oh, it's not much fun, is it? I got it when I was in the country of Haiti, and so you eat something, your body senses that something wrong, sends a message up to the brain then tells your body how to react, and with food poisoning, usually that means comes out of both ends, right? At least it did for me, when I had it in Haiti.
At the same time.
Wasn't much fun. Yeah, sometimes at the same time, Wasn't much fun. Okay, but that is how the body works. Now, the body's constantly sending messages to the brain, letting it know what it's experiencing. The brain sends messages back telling the body how to adapt. These are loops of communication. Now, I'll tell you how to remember that. The efferent pathway is the pathway from your brain to your body. Think about this. It effervesces bubbles out of your brain and down to your body. That's how I remember it, okay? The afferent pathway is from the body to the brain. And this is going on all the time, okay? Now, anyone who does not know this or understand this before they render a diagnosis is violating one of the fundamental laws of life. And I'll tell you why that's true in just a minute. So how important is the nerve supply from the brain to the body? Let's look at the scenarios. Look at bad scenario number one. The French developed what? The guillotine, right? So guillotine, when the head is severed from the body, what happens to the individual? Dies instantly, okay? Why is that? Why does that happen? Why does somebody die instantly when their head's cut off? Terry?
Because the circulatory system and the nervous system are disconnected.
Yeah, the nervous system, your body cannot live for 1 second without the impulses from the brain to the body. That's how important the nervous system is. It can't live for 1 second without it. So whenever you get a disconnection from your brain to your body, okay, the complete disconnection, you die, because you cannot live without those brain impulses, okay? So the electrical nerve supply of the brain, the body is completely severed. So this poor guy is in a world of hurt right there. All right.
Yep.
Bad scenario number two. Okay, anybody recognize him? Christopher Reeve, Superman. Yep. I thought it was one of the great tragedies of the 20th century when he got hurt.
Superman.
So much, but not all of the nerve supply is cut off. So he's got his spinal cord, part of his spinal cord severed in that horse accident. And so what happens? He can't move from the neck down anymore. Now, his organs are functioning, but it's a partial severing of the nerve supply from the brain to the body. Bad situation, bad scenario number two. Let's look at bad scenario number three. Bad scenario number three are subluxations that interfere with the nerve supply from the brain to the body. This is what literally all the people come into my office come in with. I don't see any Christopher Reeve cases, okay? They need to go to the hospital, And if you've been to a guillotine, you don't need to come to my office, that's for sure.
It's too late.
Okay, yeah, way too late.
Yeah.
That's right. But this is mainly what I see, is we have a misaligned vertebra, swollen disc, causing nerve interference to some part of the body, all right? Now, a minor subluxation, when I say minor, the enough of a weight of a dime on a nerve, okay? Think of that. The weight of a dime on a nerve cut off 60% of the nerve flow to an organ or a muscle. That's all it takes. Okay, that was one of the first things that was discovered in chiropractic research back in the 70s. A guy at the University of Colorado, a guy by the name of Chung Ha Su, was doing chiropractic research, and he found that out. So you do not need much nerve pressure in order for your body to malfunction. You don't need much at all. So a subluxation that causes pain will eventually destroy your spine if it's not corrected. So this is what a degenerative disc looks like. And when you're subluxated and that's not fixed, that's where everybody's headed, right there. And that interferes with the nerve supply wherever that nerve is going. Now, the origins of life are what triggers, it's triggered by what happens in the central nervous system. What that means is that your brain is the first thing that's formed when life happens. Brain is the very first thing that's formed. The brain is constantly doing its best to keep you healthy. There's no evidence that a healthy brain can make a body sick and create sickness in the body. Even if you never exercise, and you know people like this, they don't exercise and they eat junk food constantly. I know people like that, you know people like that. They have terrible diets, don't exercise. You wonder, how can they stay alive? How can these people, how can they push a grocery cart with all that junk food in it? That's what I always wonder. You know, how can they even do that? Where do they get the energy to do that? It's because the brain will do everything it can to keep your body alive as long as it can. It'll make all kinds of compensations and do everything it can until you take your last breath. Now I'm going to tell you a quick story. There's a story about this girl in England, and at 16 she just collapsed, and they took her to the hospital, and they did all these tests on her and they couldn't find anything wrong with her. So they went and talked to their mother, and it turns out that since she was 2 years old, the only thing that she would eat is chicken nuggets. That's it. Chicken nuggets. Okay? Now, if you know anything about most chicken nuggets, there's a lot of chemicals in those chicken nuggets. Yeah. That's all she ate. She wouldn't eat anything else. So her body did everything it could to keep her going until it couldn't do it anymore because there's not enough nutrition in chicken nuggets. So she finally collapsed. Now, I don't know the rest of the story. They saved her life. You know, she was near death. They saved her life, but hopefully she's eating better now. But that's a good example of where your body just can't adapt anymore if you're constantly putting inputs into it that aren't good for it. So let's look at the central nervous system. It starts with two cells, sperm and an egg, and they start dividing. First thing that forms is the brain. Very first thing that forms in the body. The next thing that forms is this thing called the notochord. What do you think that becomes?
Spinal cord.
Spinal cord. Okay. I'm glad somebody didn't say legs. Okay. Becomes the spinal cord. That's right. All right. And then you have off the spinal cord, the nerves grow, and everything grows off the ends of these nerves. Okay, so the brain controls and coordinates the development of the baby. Then when the baby's born, the nervous system controls and coordinates every single function in the body. So the body tries to protect things appropriately. So we have these ribs that surround our vital organs, but in the spine, you got the skull and the vertebrae that protect the central nervous system. Now, do you think that's coincidence? The central nervous system's encased in bone? You think that just happened accidentally? You know, quote, a fluke of evolution? Okay, no. No, there's a reason for that, okay? See, the most important system in our body is going to be encased in bone. You know, by weight, bone is 9 times stronger than steel. Pretty interesting. It's also a lot more flexible than steel. So, subluxations, which cut off nerve supply to the body, have been described in 4 different ways. And you know, it doesn't matter how you look at this, but dysfunctional movement of a joint irritating a nerve. Okay, that's one way it's been described. The second way is the structures around that are inflamed, and that's causing inflammation, which is interfering with the nerve. That's also a very, it's a good way to describe it, valid way to describe it, because when you irritate a disc and a ligament, they can get inflamed and cause problems. The third way is the outright compression of a disc. That's what you see on an MRI. You go in and you see the disc is herniated and actually pressing on the nerve. Okay. By the way, just so you know this, and this is a really interesting fact that most people don't know. If you took 100 people off the street who didn't have any symptoms, any pain in their legs or arms, you did an MRI on them, and these studies have been done, you'd find probably 10 to 20% that had herniated discs pressing on their nerves, and they have no pain. Okay? So just because you see that on an MRI doesn't mean that's the problem. That may be a compensation for something else going on in the body. Okay, number 4. Here's another way a subluxation can be described. An electromagnetic change because of inflammation, which alters tone in the electrical field around the nerve. So another way it can be described. And we know that. We know that when you put abnormal pressure on a bone, it creates this effect called the piezoelectric effect, which creates an electrical current in that bone that's abnormal. Okay, so that can happen in other tissues too. So it doesn't matter how you describe it, it causes nerve pressure, and that nerve pressure, that nerve interference, causes problems in the person. So we know that the evidence proves that people with this form of dysfunction, when adjusted, they get better. Now, sometimes it takes time. We'll talk about that. There's 3 ways to look at chiropractic, okay? Number one is I don't believe in chiropractic. Anybody ever heard anybody say that?
Oh, yeah.
Yeah,
Oh, yeah.
yeah. I never have, but, you know.
By the time I've been a kid, right?
Right. Okay. So, here's another one. Chiropractic is only good for pain relief. Okay? That's another one, okay? Most people come into my office for pain relief. That's okay. Okay? The third thing is chiropractic enhances the way my entire body works, and thus the expression of life and organ function. So, can somebody tell me how number 3 works? How does this work? Anybody? Just from what I've said so far? Anybody believe this, by the way?
Yeah.
Okay.
I'd say it relieves pressure.
Yeah.
That's inhibiting normal nervous electrical impulses to the body. To
the organs.
Yeah.
Yeah. Okay.
Organs, yeah.
Exactly.
Big time.
So, chiropractic is not necessarily designed to make you instantaneously feel better. What it's designed to do is make you instantaneously heal better. Big difference, okay? Because there's some problems I just can't make you feel better immediately. I wish I could, I just can't, okay? But when I adjust you, it releases forces in the body that cause changes to happen over hours and even days. Now, if you study the loop between the brain and the body, the safety pin cycle, do you think that messages need to travel at 100%?
Yeah.
Brain to the body, okay. So when you're on your phone, your cell phone, is it advantageous that the messages between you and who you're talking to travel 100%?
Yeah.
Mm-hmm.
Anybody ever had a drop call other than me?
Mm-hmm.
Yeah, we all have, right?
Yeah.
Okay, yeah. Well, that's what happens when you have a subluxation in the body. It's like a drop call. Okay, you think the liver is trying to detoxify a body needs 100% information from brain to the body?
Yes.
Absolutely, yeah. Okay, so does a heart require 100% nerve flow without interference from a subluxation to work properly?
Yes.
Yes.
Okay. Yeah, it does. And so here's an interesting story, and I'll tell you this real quick. I had a family, a mother, I've treated her before, brought her 6-year-old into me a couple weeks ago, and the 6-year-old was having heart problems, tachycardia. Little girl. Took her to the cardiologist. They couldn't find really much wrong with her. And the mother's telling me, you know, they say it's something wrong with the circuitry of the body. And I asked the mother, I said, well, where do you think that circuitry comes from? She looked at me and she said, well, I'm not sure. I said, it comes out of the spine. That's where it comes from. The circuitry to the heart comes out of the spine primarily. So that's where we need to look first. Now Keith Wasung, and he does the videos that I put up on the screen up there, he stated that thinking of chiropractic only as pain relief is like robbing a bank and stealing only pens. Now, I don't know who would do that, you know, he had a really dumb bank robber, but it's a pretty apt analogy. In other words, chiropractic is a lot more than pain relief. It's designed to keep your body functioning as well as it can. So let's look at another way that this is looked at. Let's look at back pain, okay? So one way that this is treated in the medical profession is cortisone injections, okay? Got back pain? Let's inject cortisone into it, okay? So that cortisone is pretty iffy and whether it works or not. Sometimes it does, sometimes it doesn't. I'm not saying you never should have cortisone. I'm just saying that it doesn't always work very well. It's pretty expensive. You know, it's $1,500 for a cortisone shot. That doesn't count the office visit, okay? So you count the office visit, it's $1,700, okay? So this is what we call crisis intervention. This is not health care. This patient is not being made healthier. They're trying to be pulled out of a crisis, okay? So let's look at a study. This is a December 2019 study in the journal Radiology. And here's what it said about steroid injections. And I have this study in my office. I can show it to you. First of all, steroid injections, they were looking at this cohort of patients, and they found that steroid injections accelerated osteoarthritis. Steroid injections cause subchondral, which would be this area right here, insufficiency fracture. Complications of osteonecrosis, where the bone just dies, okay, and just starts flaking away. And it can cause rapid joint destruction with bone loss, okay? So this doesn't happen in every person that gets cortisone shot, but they found that they did a study. And again, it's in this journal. Radiology is no slouch of a journal. It's a good journal. And they said, look, people with cortisone injections are a lot more prone to this stuff than people that don't get them, okay? So I would say just be careful about that. I'm not saying you should never have it. So chiropractic may be slower than a shot, but it's much more in tune with your body's need to feel safe. So if your body's giving you pain, you think it's for a reason?
Yes.
Okay. So if the oil light goes on your car, is that a sign that you need to do something?
Yes.
Okay. Yeah. I learned that the hard way when I was 16.
Yeah.
I didn't do anything. I was out in the middle of nowhere in West Texas. The engine blew up, and that was the end of that. Okay.
Yeah.
My dad was real happy.
Yeah.
I'll tell you that.
Yeah.
Real happy. Okay.
Yeah.
So covering up your symptoms makes no more sense than spray painting over the oil light if it goes on and saying, well, we're okay now. Doesn't make any sense. Okay? So, again, research has proven that a minor subluxation can shut down 60% of nerve flow. Only 10% of your nerves deal with pain. The remainder of your nerves support function. So, give me an example of function in your body.
Walking.
Walking, yeah, exactly. Anything you do with neuromusculoskeletal. What else?
Digestion.
Digestion, yeah. Heart rate, lungs. So, do you think it might be possible to have a subluxation, have no pain, but a lot of loss of function?
Mm-hmm.
Yeah. So, does that mean, what that means is, you don't necessarily have to have pain to be subluxated. You might have a lot of loss of function. Now, I'm just going to tell you a quick story. This is a teenage girl that came into she's about 20. She came in for a car accident. And so I was able to see her regularly for about 3 months. Now, I'd seen her periodically before. At the end of her care, she said, I want to ask you a question. She says, before I came in, she says, I used to have irregular, painful periods. She says, but since I've been seeing you, they're normal now. Do you think that's a coincidence? No, it's not a coincidence. No, her body started working right, okay? because the problem was in her nervous system, okay? So kids need to get adjusted too. Children who are subluxated, they may not feel any pain, okay? Instead, they may experience chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all of which stem from interference from the brain and the body, and I've seen all of that in children. Kids need to get checked, okay? Kids need to get adjusted. They'll take a lot less medication, be a lot healthier. Ask any chiropractor who has kids. They all adjust their kids. Ask them how often they're sick, how often they need to see a medical doctor, how often they need drugs. Rarely. I'm not saying never, but rarely, okay? There's an article in a prominent neurobiological journal in 2014 that said this about the upper part of the neck. It said these nerves have a great influence on the cardiovascular system and the respiratory area, this area up here. Stimulation of these areas can influence the heart and the lungs. This area also influences the entire autonomic nervous system to influence the whole body health and biological balance. It wasn't a chiropractic journal, it was a journal, a neurobiology journal. So this is one reason it's difficult to understand how chiropractic can work, because, some say you have to go back over and over for the rest of your life. Well, you don't have to do that, but people discover that they have more vitality and more health when they get adjusted, so they keep doing it, just like we keep brushing our teeth because we want to preserve our teeth. So do you think it's easier to do a tooth transplant or a spine transplant? I've never done a spine transplant before. We're decades away from that, probably centuries away from that. So so it's an intelligent thing to want to keep your spine healthy, just like keeping your teeth healthy. Okay? You don't wait till your teeth hurt and then start brushing them, right?
Right.
We brush them so they don't hurt, to keep them from hurting. Okay? So we got just a few minutes left. I had a couple more slides, but I'm not going to utilize those right now. I want to talk about vital needs. Okay, so what are the vital needs in your body? Tell me what they are. The things you have to stay alive.
Sleep.
Sleep is a vital need. Yeah, you can go without sleep for a while, but it's a need. But we're talking about even more basic than that.
Oxygen.
You need oxygen. Okay, what else do you need?
Water. Nutrients.
Food.
Okay, what else do you need?
Water.
Water. Okay, so how long can you go without food?
Long time.
Depends
Yeah.
how big you are.
Yeah, it depends on the person, right? But if you take the average sized person, take me, I might be able to do 60 days, then I die. Okay. If you take somebody a lot bigger than me, they can go a lot longer than that.
Yeah.
Okay, but 60 days is usually about the limit. Okay, then you die. So if somebody's starving, they've gone 58 days. You want to give them food, right? You want to give that person something to eat. What about water? How long can you go without water?
It's a
Couple
few
days.
days.
3 days.
It depends on a lot of things, but if you look at some of these bush tribes in Africa, they can go a long time without water because they're just used to that, walking around and hunting animals. But 5 to 7 days maybe. Okay, 5 to 7 days. How long can you go without oxygen?
3 minutes.
A few minutes.
A few minutes. That's it. Okay.
3 minutes.
And then we talked earlier about how long can you go without a nerve supply? Not even 1 second. Okay? So that's why adjusting the spine is so important. Now, eating a healthy diet is important. Drinking good, clean water is important. That's why I have that machine in there. Oxygenating your body is important. How do we do that? What's the best way to oxygenate your body? Exercise. Good job, Sandy. Yeah, I was hoping somebody wouldn't say, well, if you put an oxygen mask on and exercise. You oxygenate your body when you exercise, okay? And you keep your spine, your nervous system healthy by getting adjusted. So I want you to think about this. Who do you know that's sick a lot, that's not healthy, that has done a lot of things for their health, they're still not healthy? Those are the people that I want to see in my office. And sometimes it takes time to get those people well. Sometimes it takes time to figure them out, especially if they've been sick for a long time. But think about that. Those are the people that I want to see, okay? And you may know people like that. So you can talk to Carmen, she'll schedule them and get them into the office, and we'll just check them and see if they've got subluxations. If they don't, we'll send them elsewhere. If they need to be somewhere else, they've come in with they got a broken bone, we're not going to work on that. And I've seen people like that, right? Somebody came into me years ago, x-rayed them, had a fracture on the head of the radius. I said, yeah, I'm not touching that. You need to go get a cast, get something, get that thing taken care of. So if they don't need to be here, we'll send them somewhere else. But otherwise, we'll check them and then at least let them know what we can do. So that's all I have for you tonight. It's probably enough slides for a while. Anybody have any questions? Terry.
I got one. When Christopher Reeves fell off the horse and he got his spinal cord severed, why didn't his heart stop?
Because your heart beats due the autonomic nervous system, and that isn't necessarily always dependent on the spinal cord. It's the autonomic nervous system comes out.
Does it have a collateral nervous system?
Well, you
to the
have
heart?
the vagus nerve,
nerve,
which comes out of here, and then out of your spine, you have the sympathetic nervous system, which isn't necessarily dependent 100% on your spinal cord. But he did die early. He died sooner than he should have, and that's because that's hard on your body to have that happen. It's really hard on your nervous system.
And he was
hard
a
on
big
your health.
man, wasn't he?
Yeah, he was
6'4",